What does an extraction and socket preservation site look like 1 month after the procedure? Here's a real case from our office. This patient's a female in her 60s, and you can see on the x-ray on the right, she's got tooth number 13 that has a root canal in it. I'll highlight that here. Here's the root canal. And what you can't see in the 2D x-ray very easily, you can see in the 3D x-ray, she's got this infection around the apex, the edge of the root. We went over possibly redoing the root canal, but the patient preferred to get a dental implant. Now, real quick, before we keep going, this area to the right of tooth number 13 had been tooth number 14. It was infected and extracted at an oral surgeon office about 2 months prior to the patient coming to me. So the patient came to me to take out tooth number 13 and plan for a future implant placement. So that's what we did. So the day came to take the tooth out, and when we did, we put our bone graft in, which you can see on the x-ray on the right-hand side. Where the tooth root used to be, it's filled in with our bone particle graft. And then on the picture on the right, you can see kind of that raspberry red looking thing is our collagen plug that we put over the top of the bone particulate graft. And you can see the white stitches holding everything together. That might look like a mess to you, but it's perfect for me. We set the patient up really well to heal. When the patient came back 1 month later, this is how she looked. Now, normally we do a post-op visit less than a month out, maybe 1 or 2 weeks, but because of patient schedule, we just waited a month to take the stitches out. And after we did, we took this photo, and you can see the pink tissue around the outside of where the tooth was extracted. That's beautiful. That's pink keratinized tissue. That's a sign of perfect healing. In the center, there's some immature gum tissue, that darker red sort of tissue. That might be a little more sensitive. Again, it's a little more immature. It's still healing. But overall, at 1 month, for a patient, a female in her 60s, this is really good healing. Now, underneath, the bone is remodeling and strengthening, and you can't see that, and normally patients can't feel that. But this is how it should look. Things to look out for at 1 month would be big swelling, right? Bigger infection would indicate, bigger swelling would indicate infection, as well as bigger pain, right? Increasing pain, increasing swelling. Also a very red color, and definitely if there's any pus draining, something like that, those are red flags, and you should let your dentist know. But if it looks approximately like this at 1 month, you're probably in really good shape. I also have videos about how it should look, an extraction graft should look after 1 week and after 2 weeks, so check those out.